Namaste. I'm Dr. Shwetha Anand. I'm a fertility consultant, high-risk pregnancy specialist, and a laparoscopic surgeon as well. I practice at Basaveshwar, Nagar at a center called Janisthaa Fertility Center and Hospital. Uterine rupture, nightmare for the treating physician, nightmare for the patient who's undergoing this. It is a medical, obstetrical emergency. Uterine rupture is the walls of the uterus give away, breaking open of the uterus. So this is an emergency. When the uterine wall breaks during pregnancy, there's a lot of blood flow that is happening in the uterine walls. There'll be a lot of blood loss to the mother. Whenever there is a lot of blood loss to the mother, and after opening of the uterine wall, the baby inside also comes out, and the survival ability of the baby comes down drastically. This is a medical emergency. You have to reach to the hospital and to the nearest doctor as soon as possible. Now, as laymen, definitely we will not know what causes uterine rupture. So people who are at risk of uterine rupture would be, first one, people who have had a cesarean delivery earlier or multiple cesarean delivery earlier. So whenever the uterine healing wouldn't have happened properly, they are at risk of scar dehiscence or weakening of the scar or the uterine rupture in the next pregnancy. Uterine rupture will happen as the pregnancy is advancing. So most commonly it happens around 8th month. How do we diagnose it? How do we understand that something is abnormal? So you will know that the baby movements are not happening properly and there will be severe uncontrolled pain which cannot be explained by anything. So whenever you're having this kind of pain, you have to reach out immediately, especially when you've had a previous cesarean section. Secondly, most common is Myoma, that's the fibroid removal. So whenever there is scar in the uterus, like when multiple fibroid removal, so there'll be multiple scars on the uterus and uterus also would be weakened. So whenever this weakened uterus is undergoing pregnancy and then it can't withstand anymore, only then it will give away. Very rare situations, if they have undergone DNC earlier, which was unsupervised, and if it has led to complication, these are the kind of people who have to be careful in the pregnancy. Now, when you have this uncontrolled pain which is not related to anything, you have to reach your healthcare professional and they will do an emergency cesarean delivery and then deliver the baby and suture that is join the uterine cavity again. So these are very important. So uterine rupture is very not easy to diagnose, but then any kind of abnormality in the pregnancy, that is when you have to reach out to the doctor.